The GARI registry is the German aortic valve registry, which is one of the largest registries that prospectively collects data both on surgical patients and on interventional patients who have an aortic valve replacement or aortic valve implantation. With the GARI registry, we already showed data about high-risk patients and intermediate-risk patients, and now this is the first analysis of low surgical risk patients, where we collected all those patients who had an STS score of less than 4%, which formally defines a low surgical risk, and compared patients who underwent surgical aortic valve replacement versus patients who underwent transcatheter aortic valve replacement. We saw that if we just look at raw data, the two groups were distinctly different. So the TAVI group was much older, 11 years older, and had also more comorbidities. But if we compare the raw data, the short-term survival is very comparable between both groups. 1-year survival is better for the surgical patients, but again, these were younger patients also. When we do an adjusted analysis, things look a bit different. Then we can say that TAVI seems to be superior in the short-term survival and is non-inferior at 1 year, where we didn't see any statistically significant difference between both groups. At this point, we still have to be a bit careful with the conclusions of this study, but we can say if we do treat patients with an STS score of less than 4%, it seems that these results are not worse than surgery. That's one major information, and on the short term, maybe even better. But of course, we will have to await further data to make this into clinical routine. So there are various studies, various randomized trials that are underway that compare low surgical risk patients between the surgical and the TAVI group. And we do expect that those results will be quite similar. So at least a non-inferiority will be shown for TAVI compared to the surgical group.